In this video, we're going to talk about the really super scary, maybe the most dangerous drug that I have ever even treated in someone. And I promise you, you've got it right in your medicine cabinet and you're not thinking a thing about it. Okay, so all of us these days are aware, don't have your pain pills in your closet. If you've got kids or you've got someone with substance use disorder, don't keep alcohol out and laying around everywhere. We think about those things. We think about those prescription medicines and alcohol, and we know there's kind of a protocol. We know we need to watch out for that and to put it up, especially if you know you're dealing with someone that has a substance use problem. But what you might not be thinking about is some of that everyday medication that you're keeping around your house. Like, for example, cough syrup. Especially if you're a parent and you're watching this video, pay close attention because some of these things come in the back door and you never saw it coming. Now, almost everyone has a little cough syrup or cough medicine in their medicine cabinet. We keep it around because we had the flu or we had a cold, or we just leave it in there because we know somebody else is going to have the flu soon. But there's an ingredient in some cough and cold medicines. They call it DXM. It stands for something really long. I think it's called like Dextromethorphan. I hope I'm saying that right. You can look on the back of it and see if that is the active ingredient in what you have in your house. And let me tell you a little secret. A lot of people, especially young people, and or especially anyone that's in a treatment or recovery program, they will abuse this stuff. And it is so scary dangerous. I'm telling you, I've had more people end up in the hospital over dang cough medicine than anything else that I've treated. Because when people abuse this stuff, they take tons and tons and tons of it. It's not like you can take your one little capful and get messed up. No, you gotta pretty much take the whole pack or the whole bottle. Like Robitussin, they call it Robotripping. Or there's some medicines they call it Triple C's. It's in these little pill push packs, where you pop them out of the back. I think they're red. Back in the day, they used to call them Skittles because that red coating on there has some sort of sugary flavor. But when people abuse this, they take all of it and it gets them super messed up. A lot of times people will do this at night because they think everyone's asleep and they can get by with it. And people are particularly prone to do this when they're in treatment programs because they're trying to find ways to get high or get messed up that won't show on a drug screen. That's right. This medicine is very hard to detect. It's hard to catch someone doing it. And so if you just give someone a regular, normal drug screen, it probably isn't going to show it. But I'll tell you a little secret tip here. If someone's doing DXM, a lot of times it will actually show up on a drug screen as a false positive for PCP. Now, I've been doing this kind of work for a long time, and I don't think I've ever seen anybody actually show positive for real PCP. That was pretty popular a while back, but you don't see that much anymore. So if I ever see someone screen positive for PCP, then I know they've probably been doing DXM. So you can screen for it, but you can't screen directly for the DXM, but it will show sometimes a false positive for PCP. The symptoms that you would see would be, a lot of times they can have hallucinations. I've had a lot of kids end up in emergency rooms. I've had kids fall out of their seat in school and end up in an emergency room being totally out of their head, getting every kind of diagnosis under the sun. And a lot of times because they're tripping on this DXM. So be careful. There are all kind of things. When people are desperate, they'll do pretty much anything to get messed up. That's what addiction is. A desire and a need to escape or fix something inside or avoid, and you're just trying to find something to do that. So watch out for this one. This is the one that you never saw coming, and I promise you it causes a lot of damage. It's so scary because people take so much of it, it literally shuts their liver down and can be so very dangerous. So watch out if you're dealing with someone with a substance use disorder and you got some of this around your house, just put it up. Take precaution. Don't even put it out there to be tempting. Oh, one last thing, and I totally forgot. Another reason why people get this stuff, especially when they're in a treatment program or when they're young, is because it's cheap. In fact, it's so cheap, most of the time they just steal it. When I'm treating someone and their family's like monitoring all the money they spend and they want receipts and all that stuff, this is when they'll go to this medicine because they can just take it off the shelf and there's no receipt or paper trail for it. Now, a lot of stores have chosen to like put this away or behind the counter, you have to ask for it. But there are other stores that don't. And trust me, your loved one knows exactly which ones those stores are.